afternoon, everyone. Thank you for joining us this afternoon. My name is Candice and I'm a lecturer from Nanyang Polytechnic and a pharmacist by training. Today, my colleague and I will be sharing with you on aging gracefully with proper diet and medications.
Hi, good afternoon. My name is Claudine. I'm a lecturer from Nanyang Polytechnic and I'm also a dietitian by training. So today, I'm going to share with you a few more about how diet can actually help us to manage our chronic diseases such as type 2 diabetes, high blood pressure, and high cholesterol. So let's do a quick poll. Managing diabetes, high blood pressure, and high cholesterol is as easy as following my healthy plate. Yes or no? So what is my healthy plate? Have you heard of it before? My healthy plate is actually a visual tool to actually help us to plan our diet and to ensure that we actually consume all the nutrients that we need and without omitting any of the particular food groups. So we need to understand what food is all about, what nutrients is all about. And very importantly, in this nutrition science, we always need to remember that there's no one food that gives us all the nutrients that we need. So we need to have a variety of food, we need to have a balanced amount of food and a variety. So how do we actually achieve a healthy and a balanced diet? So that's why we have this My Healthy Plate to guide us along. And this will tell us how much food should we portion out on a plate without eating too much or eating too minimal of the various food. And talking about diabetes, high blood pressure, high cholesterol, what's the best way to prevent it to start off with? Is it as simple as having My Healthy Plate? Or is there any special diet that we need to adhere to actually prevent us? So I see that majority of you say yes. Very good. So My Healthy Plate is actually a very easy tool for us to manage our diabetes, high blood pressure, high cholesterol. So let's move on. So today I'm going to share with you about understanding chronic diseases. I'm just going to highlight 3 diseases like high cholesterol, high blood pressure, and diabetes. And follow on, I will talk to you about the dietary management of these conditions. So first, we'll start out with high cholesterol level. So before I talk to you more about high cholesterol level, I'll just share with you a short video that's developed by Heart Foundation from New Zealand.
Cholesterol is a fat that travels in your bloodstream through your body. Your cells use cholesterol as a building material. Over time, a lot of cholesterol can build up inside the walls of your arteries. A buildup of cholesterol causes fatty streaks to form in your arteries. This is part of a process called atherosclerosis, which narrows and stiffens the arteries. The longer the cholesterol sits in the artery walls, the harder it gets. Eventually, a fatty streak can get so large and hard that it cracks, causing a clot to form around the crack. This clot can block the artery, causing a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your cholesterol and risk of heart attack or stroke affect this? There are small steps you can take today to lower your risk. If you smoke, stop smoking. Make heart-healthy eating and drinking choices. Move more, lose weight. Talk to your doctor about medications.
Okay, so we have watched the video, so you have a bit understanding about cholesterol. So and you also understand from the video on how cholesterol actually has an impact on our cardiovascular health. So cholesterol is actually a fat-like substance in our blood. So it actually comes from 2 different places. One is actually from our diet. So you may have heard of people saying eggs are high in cholesterol, too much of it may lead to high cholesterol levels in our blood. So cholesterol can come from food. And the second source of cholesterol is actually from our body itself. Our liver produces cholesterol. But cholesterol is not always bad. We still need some of them in our body to ensure that our body works well. For example, we need that to make new cells, we need that to make hormones, and definitely to process and digest the fats that we consume. And if let's say we have too much of cholesterol in our diet or in our blood, then of course this will lead to some chronic diseases like heart attack or stroke. There are various types of lipids. Okay, when you go for your blood test, you probably have seen they say high density lipoprotein, low density lipoprotein, triglycerides. So what are all this? So we start with low density lipoprotein, LDL. LDL is also known as bad cholesterol. They are the ones that builds up in our arteries and eventually cause lumps of hard fat called plaque to form on the arteries walls. So when these plaque falls off, it breaks apart, it can actually block our arteries, and this will eventually lead to heart attacks or stroke. If let's say it blocks the artery that supplies the blood to the heart, that's when we get heart attack or get heart problems. And if it blocks off the blood supply to the brain, that's when we get stroke. And next, we have this high density lipoprotein cholesterol. These are the ones that we term it as a good cholesterol. I would usually say they are like a vacuum cleaners in our arteries. They go around our arteries, they pick up all the LDL cholesterol, the bad ones, some of the fats, and they bring it back to the liver for breaking down before it's excreted out from the body. So which is why they are good. The more we have, the better our heart health. And the next thing is triglycerides. Triglycerides is also known as our blood fats. They make our blood very thick, very sticky. And where do they come from? So if let's say we consume more calories than what our body needs consistently over a period of time, this is when we start to have a lot of fats in our body, and these are actually the triglycerides. So the more we have, then of course this increases the amount of plaque in the arteries walls. So we also want to achieve a healthy level of triglycerides in our blood, in our body. So what causes high cholesterol levels? Of course, when we have high saturated fat intake. So what is saturated fats? We'll talk about that later. Then if let's say we have too much of sugar in our diet, like too much of sweetened beverage drink, too much of processed carbohydrate like white bread, white rice, or excessive alcohol intake, not exercising enough, smoking, or excessive abdominal fats in the body, this can actually lead to high cholesterol level. So if you look at this diagram, you can see the blue little circles represents the good cholesterol. The orange one represents the bad cholesterol. So if let's say we have a lot of LDL, the bad cholesterol, you can see it's actually blocking our arteries. Next, I'll talk about high blood pressure. What is high blood pressure? Okay. So it's actually a condition whereby the force of the blood pushing against the wall of the vessels is consistently too high. That means every time you take a blood pressure, it's always high. So how do I know whether I have high blood pressure? Is when there's a systolic BP. The systolic BP is more than 140 mmHg or more, or the diastolic blood pressure is 90 mmHg or more, or both systolic and diastolic blood pressure is more than 140/90. And this is when we have hypertension. So what is systolic? What is diastolic? Systolic is basically the pressure in the blood vessels when our heart contracts, because our heart actually contracts and rests, and it contracts and it rests in between all the beats. So if let's say, so systolic refers to the pressure in blood vessels when heart contracts or beats, whereas the diastolic, the one that is the number you see below, is actually the vessels when the heart rests between the beats. So what causes high blood pressure? Again, poor diet. That, for example, a person with high salt consumption always enjoy very well-flavored food, add a lot of sauces, add a lot of salt in their food, or a person who has a high saturated fat or trans fats intake, low intake of fruits and vegetables, it causes a very huge role in high blood pressure. And definitely if a person do not exercise, or they have a consumption of alcohol and they smoke, or a person who is overweight or obese, these are actually some factors that lead to high blood pressure. And next, you have diabetes mellitus. I guess this term is not new to everyone because you probably have heard the Health Promotion Board talking about it so many times. So what is diabetes mellitus? It's actually a condition where our body cannot regulate our high blood glucose level. Two possibilities. One is that our body, our pancreas particularly, an organ, is not producing enough insulin, or our pancreas is not producing any insulin at all. So in other words, not producing enough, or it's not producing. But there are too many types of diabetes, and today I'm going to cover type 2 diabetes only. So over here, I'm going to show you a quick overview of type 2 diabetes.
About 90% of people with diabetes have type 2 diabetes. If you've got type 2, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 2 diabetes, Your body still breaks down carbohydrate from your food and drink and turns it into glucose. The pancreas responds to this by releasing insulin. But because this insulin can't work properly, blood glucose levels keep rising, so more insulin is released. For some people with type 2 diabetes, this can eventually tire the pancreas out, meaning their body makes less and less insulin. This causes even higher blood glucose levels. So what does this mean? Well, as your body can't get enough glucose into your cells, a common symptom of type 2 diabetes is feeling very tired. Other symptoms include needing to wee a lot, feeling extremely thirsty, cuts and grazes healing slowly, and getting infections like thrush. A lot of people don't get any symptoms or they don't notice them. Some people don't think the symptoms are important, so don't ask for help. This means that people can live with type 2 diabetes for up to 10 years before being diagnosed. And over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the effects of diabetes and high glucose levels can be managed. So if you've got any of these symptoms, see a doctor as soon as possible. There are different ways of treating type 2 diabetes. Some people can manage it by healthier eating, being more active and losing weight. Eventually, most people will need medication to bring their blood glucose down to a safe level. Whatever the treatment, everyone with type 2 diabetes needs to learn how to live with it. We help people do exactly that. Take a look at our website to see how we can help you. Our researchers are also investigating ways to put type 2 diabetes into remission, so people's blood glucose levels return to normal and stay there. And they're finding out more and more about type 2 diabetes, so that we can do more to prevent it, find new ways to treat it, and one day find a cure.
Okay, so that's a very short video to give you an overview of type 2 diabetes, how it occurs, what happens to the body when a person has type 2 diabetes, what are some of the symptoms to type 2 diabetes, and what are some of the ways to manage it. So now I'm going to share with you very briefly, type 2 diabetes is a very common form of diabetes in Singapore and also worldwide. And it's mainly because the body does not use the insulin properly, or they may not even be producing enough, causing the blood glucose level to rise. And where do the blood glucose comes from? So from all the carbohydrates that we consume from our rice, from our prata, chapati, from our biscuits, bread, all this, these carbohydrates, when we consume it, our body actually breaks them down and convert them into glucose. So subsequently, this glucose is actually absorbed into the bloodstream. So naturally, our blood glucose level will start to rise, and this is when our pancreas will produce insulin to help to counter this high blood glucose level. But in the case of a person with type 2 diabetes, this insulin is not functioning well, or the pancreas is not even producing enough insulin, so the blood glucose level will continue to rise. So to compensate this, our pancreas will just continue to release more and more insulin. So this insulin is needed to bring down this blood glucose level. But since it's not working, our body produces more and more, and this will actually lead to another kind of effects to the body. So as a result of that, when they keep producing more insulin, but the blood glucose level doesn't seem to drop, this is when the pancreas will start to feel tired, and then they will start to produce lesser and lesser insulin. And of course, with this happen, it increases blood glucose level and poses a person to be at risk of hyperglycemia. And when the body keeps producing insulin, yet unable to bring down the blood glucose level, this insulin itself will actually cause other problems such as high triglycerides level. They will cause this glucose to be converted to triglycerides. It may cause high uric acid. It may actually cause the hardening of our arteries. It can cause weight gain, hypertension, and of course, eventually type 2 diabetes. So now we talk about how all these diseases are formed, what happens to the body. So now let's share something positive, how to manage these conditions. So in order to manage high blood pressure, high cholesterol, type 2 diabetes, it's very, very important for us to have a well-balanced diet, which includes a variety of food. And of course, when a person has diabetes, we would want them to have an appropriate and consistent, that's a keyword, appropriate and consistent amount of carbohydrates, or starchy food in each meal to help to achieve a constant blood glucose level. It means in the morning, I have this amount of carbohydrates. Lunchtime, I have perhaps a bowl of rice. Dinner time, I have another bowl of rice. And it's not saying morning I don't eat, or morning I eat a lot. Lunchtime, I eat moderate amount. Dinner, I don't eat at all. This is not right. Okay. And next, we need to have regular meal timing each day. Try to have a regular meals at similar timing. Have more fiber-rich food. We eat less fat or oily food, especially saturated fats or trans fat. And of course, reduce the intake of salt. So looking at this dietary management, isn't it the same about my healthy plate? Yeah, so my healthy plate basically teach us how to achieve a good diet and help us to manage all the chronic diseases which I've mentioned earlier. But of course, I'm going to tell you more about my healthy plate. So first we talk about fruits and vegetables. We need to have half the plate to be filled with fruits and vegetables. Why? Fruits and vegetables, they're naturally low in saturated fats and trans fats. And they are also very high in dietary fiber. So what actually dietary fiber does do to the body? First, when we have dietary fiber, because they don't digest, so they are not digested in the body, they stay intact from the point we consume all the way until we pass them out. So it actually makes a person feel fuller. So naturally, when we feel fuller, the tendency of overeating will be minimized. And this, of course, will help with weight management. And with a good weight management, it's also the time where we will reduce our risk of all the diseases. And secondly, fiber itself, there are different types of dietary fiber. There's one type of fiber called a soluble fiber. They would actually bind the cholesterol in the gut, and therefore it can actually reduce the absorption and remove from the body. So this actually helps us to reduce our blood cholesterol level. And lastly, fruits and vegetables are very, very high in vitamins, minerals, and antioxidants. They actually help us to reduce the risk of heart diseases or the cardiovascular diseases. And of course, we say fruits and vegetables are good, but how you prepare it plays a very important role as well. So if let's say I cook using a healthier method like stir fry, saute, I boil in soup, roasting, steaming, these are perfect. But if let's say I have a bowl of salad, but I add high amount of the regular mayonnaise, and this is going to increase the fat content in my bowl of salad. So we may have to consider how we prepare our fruits and vegetables. And of course, when we eat fruits, we try to have it in a form of whole fruit rather than juice to get the best of their nutrients. Because in the process of juicing, a lot of nutrients are actually lost along the way. And when we consume our fruit juice, if let's say we omit all the pulps, we are actually not consuming the dietary fiber. So it's actually better for us to consume it as a whole instead of in the form of juice. So the next part of my healthy plate, I'm going to talk about brown rice and wholemeal bread. So we fill a quarter of a plate with whole grains. So we will have brown rice, wholemeal bread, wholemeal biscuit, rolled oats, or those wholemeal bihun, kway teow, noodles, chapati, etc. And we need whole grains in our diet, even if you can identify these are actually carbohydrate source of food. So even if a person has diabetes, doesn't mean that, oh, I should omit carbohydrates from my diet entirely. No, we shouldn't be doing that, because the primary source of energy in the body is actually carbohydrates. So it's still important for us to consume whole grains in our diet, but we just need to consume at the right amounts. And whole grains itself also contains a range of different nutrients like vitamins, especially the B and the E's, minerals like iron, zinc, and magnesium. We have the phytochemicals like the lignans, phytosterols, which are very helpful for our to reduce our blood cholesterol level, and a type of inulin, which is a type of dietary fiber. And again, these are the ones that slows down the rate of glucose release into the bloodstream, because whole grains itself, with high amount of dietary fiber, our body takes a bit longer to break down. So the amount of glucose or the amount of carbohydrate being broken down to glucose is slowed down. So this will actually reduce the rate of glucose release into the bloodstream. And of course, with all the dietary fiber, again, it binds with the cholesterol, therefore reducing absorption and increase the excretion of cholesterol from the body. And it also reduces the blood pressure. And as a whole, whole grains also reduce the risk of developing heart diseases and diabetes and help us in terms of weight management. So you may be thinking, what about all the regular white rice or white bread that I consume? And what's the difference between these and whole grains? So if you look at the image, you can see a whole grain actually contains a bran, endosperm, and germ. So when we consume whole grain, we are actually consuming bran, endosperm, and germ all together, especially the bran and the germ. These are the ones that are packed with all the various nutrients. But upon processing, bran and germ are removed, and what we are consuming are basically endosperm, which are basically just a starch. So that's why whole grain is much better, because we're actually enjoying all the nutrients that is present in a whole grain. So next, we'll look into meat and others. This is another quarter of the plate, which we have to fill up with all the protein-containing food, such as poultry, like duck, chicken, turkey, or meat, like beef, mutton, and pork. Even things like seafood, eggs, nuts, bean products, lentils, or low-fat dairy products. All these are very rich in protein. We also need protein in our diet. We cannot leave them behind, because we need them to repair ourselves, maintenance, build our immunity. Just imagine your hair all the way down to your toenail, they're all made from protein. So if let's say we omit protein from our diet, we would have problem with wound healing. We may fall sick very easily, even like antibodies to keep ourselves strong. All these are made from protein. So we need to have them in our diet. And how much? And we also need to have at least 2 servings of fish per week, of which that I mentioned earlier, we should have at least 2 servings of fish. What do we mean by 1 serving? About 1 palm size? This is about 1 serving. 1 palm size, about the thickness of your palm, that's 1 serving. So we need to have at least 2 servings of fish per week. For example, especially the oily fish like tuna fish, mackerel, tingiri batang. All these are very rich in omega-3 fatty acids. They are the polyunsaturated fats. They have beneficial effects to heart health. They have beneficial effects to our cholesterol level. And again, cooking method plays an important role. You may have mackerel, but you deep fry, this will actually have a lot of fats inside. And if let's say you would like to control your blood glucose level, blood cholesterol level, but you deep fry your food, then of course there will be some counter effects to that. And of which we notice one of the source of protein is actually low-fat dairy product. Why do we need to have that? It's because there's calcium present inside. Calcium itself is not just to build our bones, to strengthen our bones, to prevent us from osteoporosis. It actually has some roles in terms of managing our blood pressure as well. So some good sources of calcium are like milk, yogurt, cheese. But what happens if, let's say, you have lactose intolerance, or you just don't like the taste of the milk so much for various reasons? Don't worry, there's other sources as well. So things like fish with edible bones, like sardines, you eat together with the bones, or ikan bilis. Or you can have tofu that's made with calcium salts, because this is a source of calcium. Lentils, or green leafy vegetables, or you can have bread, biscuits, soybean milk, or orange juice that say there's calcium added into it. These are good sources of calcium as well. And next, in this healthy plate, it also advises us to drink water. Choose water. Why? When we talk about water, we basically refers to the normal plain water that we drink, because they are calorie-free. And they can help us to quench thirst very effectively as compared to all those sugar-sweetened beverage. And of course, all this sugar-sweetened beverage, they can actually cause us to put on weight. And when our weight is increased, it will lead to poor glucose control. Okay, when there's poor glucose control, it may eventually lead to other problems as well. So weight gain itself is the main cause of many other chronic diseases. And of course, excessive sugar in the diet can also increase our blood triglycerides level, because there's so much sugar, so eventually the body actually converts them into fats, which is our triglycerides. And also don't forget things like white sugar, brown sugar, rock sugar, honey, or any type of sugar to make your drink, to any type of sugar to any drink, they are all called the sugar-sweetened beverage. So regardless, you say, oh, I take brown sugar. Brown sugar has the same effects as white sugar, to be honest. Okay. And next, use healthier oil. I know if let's say you cook at home, a lot of people always tend to ask, so what type of oil should I use? What type of oil should I choose? Can I eat this? Can I take that kind of oil? So using these infographics from the American Heart Foundation, this actually tells you that there are a few different types of fats. There's unsaturated fats, like the monounsaturated and polyunsaturated fats. We have the saturated fats, and we also have those trans fat or hydrogenated fats. So unsaturated fats are good ones. There are some sources like olive oil, canola oil, salmon fish, all these oily fish, nuts itself like almonds, hazelnuts, walnuts, the various types of nuts, they're very high in unsaturated fats, and they're very good effects in our cholesterol, in improving our blood cholesterol level. In fact, some of the polyunsaturated fats can actually reduce our total cholesterol as a whole, and monounsaturated fats can actually help to increase our good cholesterol and brings down the bad cholesterol. And next, we have the saturated fats. Saturated fats are mainly from all the primary source are, and primary source of saturated fats are animal fats, like all the steak, well-marbled steak, they say it's so juicy, so nice to eat. But all these fats are saturated fats, okay? And even things like poultry skin, like chicken skin, duck skin, they are very high in saturated fats. Even things like full cream dairy products, full cream dairy products, or the full cream, all these are actually very high in saturated fats as well, which is why we advise people to go for low-fat dairy products instead. And of course, there are some plant sources like palm oil and coconut oil. They are very high in saturated fats, and we should actually limit the intake of these. And lastly, things like trans fat. Trans fat are hydrogenated fats, shortening, all this to make our pastry flaky, or to make our cake taste good, or even to prolong the shelf life of the particular food product. These are actually bad. They are the ones that actually increases our bad cholesterol and brings down the good cholesterol. So this is how we should control, or this is how we should avoid and to eat the types of fats. And some of you may cook at home, or they may say, so what type of cooking should I buy when I cook? I always tell previously when I tell my patients or tell people, when you buy a cooking oil, you can just choose 100% pure cooking oil. That means you can buy soybean oil, peanut oil, rice bran oil. Just make sure they're 100% pure. Because if some of you may choose blended oil, you may realize that there's palm oil, PALM, added into the oil. And palm oil is very high in saturated fats. So high intake of it can actually increase your blood cholesterol level. Okay, but of course, if let's say you want to buy blended oil, such as olive oil blend with canola, that's fine. But as long as you don't see, so easier way, look into the ingredients list. If you see the word PALM, palm, try to avoid that. Try to limit those intake. Some food manufacturers may make it sound very attractive, like deodorized, refined palm olive oil. But again, when you see the word PALM, it actually means palm oil. So we will limit the intake of these. Okay. And again, despite saying all that, canola oil, sunflower oil, peanut oil, rice bran oil, all these are better, doesn't mean that you can actually be liberal in your diet and have high amount of high-fat food, because fats are still fats. The amount of calories it contains is still the same. So we should consume in moderation. And of course, when we cook, we choose the healthier cooking methods. And the last few things to talk about: be active. Exercise is very, very important to achieve good health. It can actually reduce our blood pressure, improve our blood cholesterol level, regulates our blood glucose level, and attain a healthy body weight. So how long should I exercise in a week? So total 150 minutes of physical activity per week. So if I break it down, maybe Saturday and Sunday, you do not want to exercise. So maybe Monday to Friday, 5 days. So that means you exercise 30 minutes per day. Okay, so what should I cut down in order to manage the chronic diseases like high cholesterol, high blood pressure, and diabetes? So first, we talk about sodium. Okay, sodium basically can be found in table salt. So a table salt that we used to add in cooking, it contains about 40% of sodium. And it's also very important for you to know how much sodium is there in a salt, so you can control the amount you use. So for about half a teaspoon of salt, there's actually about 557 milligrams of sodium. And just for your information, we only need about 2000 mg of sodium per day. So if let's say I consume 1 teaspoon of salt in a day, I've actually exceeded the amount my body needs. And too much intake of salt can actually lead to high blood pressure. And if a person with consistent high blood pressure, it can lead to all the cardiovascular disease like heart disease, stroke. It can also lead to things like kidney disease or retinopathy, which is the eye disease. And salt contains sodium. And when we consume too much of sodium in our diet, like we add a lot of salt in our food, or maybe after adding soy sauce, I add oyster sauce that I taste doesn't taste very good, I add some salt again. All this amounts up to the high sodium intake in our diet. So when there's too much of sodium, it will actually cause the body to hold more water to remove all the sodium. Because our body is very smart, they always try to find ways to compensate itself. When there's too much sodium, they try to find ways to get rid of it. So in this case, they actually hold more water in the body to remove the sodium. So as a result, our blood volume increase, causing our blood pressure to rise. And so with the extra water, it actually causes a lot of stress to our heart and our kidneys. So what are some of the sources? Hard cheeses like cheddar cheese, they're very high in sodium. Canned products like canned vegetables, canned beans, or even salted and preserved food like all your ham, bacon, luncheon meat, lapchang, sausage, salted fish, salted egg, ikan bilis, all these are very high in sodium. Like condiments like soy sauce, some of the dressings, marinades, or those flavored dressings, tomato, chili sauce, oyster sauce, or some seafood, olive, some legumes, they can have a slightly higher amount of sodium. And even, of course, table salt, sea salt, kosher salt, all these are source of sodium chloride, which is a type of salt. So like I mentioned, you need about 2000 mg of sodium per day, so which is about 5 grams, or about 1 teaspoon of salt, okay? So what ways to reduce? Well, of course, you try to consume more fresh food, like instead of canned vegetables, I go for the fresh vegetables, whole grain food, beans, peas, legumes, or even like canned tuna. We try to purchase those that are tuna in water instead of those tuna in brine. So this can actually help to reduce your sodium content. So we can try to use recipes that use fresh ingredients. When we cook, we try to reduce the usage of sauces, stock cubes, or seasoning powders. We try to use natural herbs like garlic, ginger, spices, cinnamon, cloves to flavor our food. And you prepare your own stock instead of using those over-the-shelf stock, because you can control the amount of salt you want to add into your stock. And of course, when you're eating out, you can actually request for less sauces or gravies to be added. And when you cook, you can taste the food before you add extra salt or sauces. And of course, avoid finishing up all the broth or sauces because they contain high amount of sodium. The next thing to reduce is sugar. Okay, added sugar shouldn't contribute more than 10% of our dietary intake. So what do we mean? So if let's say a woman requires 1,008 calories per day to maintain their weight, so the recommendation for added sugar is actually less than 10% of their dietary energy. So that means 10% of 1,008 calories, about 180 calories, and 1 gram of sugar contains 4 calories. So this actually means that they can only contain about 9 teaspoons of sugar per day. So where are sources of sugar? Apart from just a normal table sugar we add into our coffee and tea, it can also be from desserts, cakes, candies, fruit juices, honey, jams, etc. And lastly, also alcohol. Heavy alcohol intake can cause us to have a reduced blood glucose level, because when a person drinks so much alcohol, they may not eat. So when they do not eat, their blood glucose level may drop. Okay, and of course, when a person drinks too much alcohol, it may cause them to vomit. So when we vomit, it can reduce the insulin production. So as a result, our body may actually find alternate ways for energy. So in this case, they may break down fats or energy. So as in the process of it, they can actually produce harmful chemicals and leading to a very serious condition. And of course, when a person drinks too much alcohol, so much that it goes beyond the threshold of the amount that our body can break down, this excess alcohol turns into triglycerides, which is why a person who drinks excessive amount of alcohol, they tend to have high amount of triglycerides level, they tend to put on weight, they tend to have what we call the beer belly, okay, because they are mostly abdominal fats. So we are not saying you can't drink at all, but we drink in moderation. No more than 2 standard drinks per day for men, and for women, not more than 2 standard drinks per day. So you may be asking, what is 1 standard drink? So 1 standard drink refers to beer of a 5% alcohol content, about 1 can, 330 ml, or a wine which is about 15% alcohol content. So you can have about half a glass, about 100 ml, or shots like all the spirits, about 40% alcohol content, about 30 ml, 1 shot glass. That's 1 standard drink. So if let's say you want to have a wine, so just remember, don't go more than 1 glass for ladies. So in summary, how to manage your medical conditions like high blood pressure, high cholesterol, diabetes. First, please adhere to my healthy plate to make sure that you have a balanced diet, you have a variety of food, okay? And next, we need to achieve a healthy body weight. Then consume sufficient amount of whole grains, eat your fruits and vegetables, choose and prepare food with less fat, especially of saturated fats, and of course, prepare food with less salt, less sugar. So now, thank you very much. So this is the end of my talk, and I'll pass the time to Candice, and she'll tell you more about medication used in elderly. So Candice, please.
Thank you, Claudine, for the informative talk. So now I'll move on to medication used in elderly. All right, now before I begin my talk, let's just do a poll. Do you have any of these diseases? Diabetes, high blood pressure, or high cholesterol? If you do, please help us to enter yes. If not, just put in a no. Now, we do know that as we age, the tendency of us developing any of these three highs, meaning high blood glucose, high blood pressure, and high cholesterol will increase. So I would say that quite a large percentage of our elderly populations actually have one of these three diseases, or maybe even more than these three. So what we are so concerned about these three diseases is that when it starts, there's no symptoms. Patients do not experience any symptoms. It's usually only diagnosed through health screening, or when something has already happened, such as a stroke or heart attack, and by then we know that it's a little too late. And these three diseases are actually highly modifiable by lifestyle changes, as Claudine has mentioned through her talk on diets. It can also be very well controlled by medications as well. All right, so we're still waiting for the answers to come through your Facebook poll. Okay, so from the poll, we can see that the majority of you actually have either one of these three. So I shall move on with my talk. So my talk today will cover on physiological changes with aging. Essentially, that is the changes in your body as you age. And then I will move on to medications that are used to treat diabetes, high blood pressure, or high blood cholesterol. Now, providing safe, effective drug therapy is one of the greatest challenges in elderly simply because in this age group, they use more drugs than any other age group. And this is also coupled with the fact that elderlies, they usually have diminished physiological reserve. What this means is that as you age, your body reserve will actually decrease. So this actually predisposes elderly to an increased risk of adverse drug effects, which is side effects of the drugs. Now, elderly sometimes also have altered responses to many drugs, and because of many reasons such as immobility, lack of financial support, or reduced cognitive function, many elderlies are unable to obtain or afford drugs or adhere to complex drug regimens. And to make things even more challenging, drug symptoms can sometimes appear very different in elderlies. All right. So what are some of the physiological changes that are associated with aging? First thing first, we look at the body composition. As we age, our total body water will decrease, and the total amount of body fat will increase. So now in medications, we have drugs that are what we call water-loving and drugs that are fat-loving. So what this means is that in an elderly who is on fat-loving drugs, they may actually need a reduction in the dose because there is a higher body fat content, so the drugs tend to stay longer in the body. In terms of the heart system, cardiovascular, elderlies have an increased risk of orthostatic hypotension, which is the drop in blood pressure as you switch from a position of lying down to standing up or sitting down to standing up. If you switch very quickly, sometimes you feel that lightheadedness or giddiness. That is actually a drop in blood pressure. And as we age, our arteries will also begin to lose elasticity. So this actually causes our blood pressure to increase. So it is not uncommon to notice that as you age, your blood pressure tends to increase bit by bit. Okay, so the problem comes when the blood pressure increases too much. In terms of your central nervous system, there will be a drop in blood flow to your brains. There will also be a reduction in the sensitivity of your nerve endings. And your gastrointestinal system will also be affected. there will be a reduction in your gastric emptying rate, meaning that the stomach, the content in your stomach will take a longer time to reach your small intestine. Now, drugs are usually absorbed in your small intestine. So what this means is that as we age, we may notice that for certain medication, in fact, a lot of medication, it takes a longer time for you to see the effect of the drug, simply because the drug stays in your stomach for a longer period of time before it gets to the small intestine to be absorbed into our bloodstream. And also for elderly, there is a drop in motility of your large intestine. So what this means is that you will be more prone to constipation. Now we look at the liver and the kidney function of patients as they age. You can see that as we age, our liver and kidney function will be reduced because there will be a drop in your liver size, drop in your liver blood flow, drop in your kidney blood flow, and drop in your kidney function. So what this means is that sometimes medication can stay longer in your body because the kidney and the liver are the main organs that are involved in clearing the drugs from your body. So now I move on to medication that are used in diabetes. So as Claudine has mentioned earlier on, diabetes is actually a group of metabolic disorder characterized by high blood glucose. There are many types of diabetes. There's type 1, type 2, gestational diabetes, and others. So what I'm going to cover here is the medication that are used in type 2 diabetes. Okay. So also Claudine has mentioned earlier on that in type 2 diabetes, it is usually characterized by a combination of some degree of insulin resistance, meaning that the body doesn't respond so well to the insulin that's secreted in the body, and also coupled with a relative lack of insulin secretion, meaning that the body is not able to produce sufficient insulin. So most individuals with type 2 diabetes, they tend to exhibit some form of abdominal obesity. So the central region of their body tend to have a higher percentage of fat accumulation, and that actually has been thought to be a major contributor to insulin resistance. Some of the potential complications of diabetes mellitus actually includes heart diseases, cardiovascular diseases such as heart attack, all right, or nerve diseases, neuropathy, kidney diseases such as nephropathy, eye diseases, retinopathy, and diabetic patients may also have a higher rate of dying, which is increased mortality. So there are many medications that can be used in the management of type 2 diabetes. We have oral medications. We also have injection. So I'll be covering the oral medications first. So the oral medications that are used in the management of diabetes can be broadly classified into 3 groups. We have insulin secretagogues, which increases insulin secretions. We have insulin sensitizer, which increase tissue sensitivity to insulin. And we also have medication that helps to reduce the glucose absorption. But in the interest of time, I will only be covering those drugs that are circled in red. So first medication that I'm going to talk about is sulfonylureas and meglitinides. So for sulfonylureas, the ones that are commonly found in Singapore are glipizide, glibenclamide, glimepiride, dopudamide, and for meglitinides, we have ripaglinides. So how do these 2 drugs work? They work by helping your pancreas to produce more insulin. Now, some things to note, these 2 drugs are actually quite prone to causing hypoglycemia, which is low blood sugar, especially in elderly. So this is very important. I mean, patients should be educated about the fact that if they're on this medication, it is even more important that they maintain the recommended diet, all right? Because we don't want them to have low blood sugar. Now, these 2 medications may sometimes also cause weight gain, which can be quite a problem in diabetic patients because we know that weight gain can actually cause insulin resistance to be worse. So all the more, patients should maintain the recommended diet. All right, so patients on these 2 medications should also take these 2 medications before food. Then the next class of drug that I'm going to talk about is your DPP-4 inhibitors. DPP-4 stands for dipeptidyl peptidase 4 inhibitors. This is quite a relatively new class of drug, I would say. So what we have in Singapore is sitagliptin, linagliptin, and vildagliptin. And how they work is that they help your pancreas to produce more insulin and reduce your liver production of glucose. Now, the good thing about this class of drug is that they actually have a lower risk of hypoglycemia, which is low blood sugar, and they are not very likely to cause weight gain. But there are reports that this class of drug may actually cause severe joint pain and acute pancreatitis, which is the inflammation of your pancreas. But do note that these reports are actually quite rare. So, but if you do notice any of all these symptoms coming up, you should go and see a doctor immediately. Now, for DPP-4 inhibitors, we don't usually use it alone because by itself is not effective enough. So they are usually used in combination with other drugs such as your sulfonylureas or your metformin, which I'm going to talk about it later on. Then we move on to bigonides, metformin. This is the most popular drug, which is the first-line therapy in diabetic management for most patients. So how do they work? They reduce your liver production of glucose. They also increase insulin sensitivity. Okay. Now, this class of drug is very effective. So patients who are first diagnosed with diabetes are most likely to be prescribed this drug unless they have unless they are not able to tolerate this drug. But some things to note: metformin can sometimes cause vitamin B12 deficiency. So patients are encouraged to consume consume food that may be richer in vitamin B12, and some patients may require vitamin B12 supplementation. This drug can also sometimes cause a metallic taste in the mouth. So we do have patients coming back to us telling us that after they started on this drug, they feel that their palate has changed. It's likely due to metformin. Now, but the good thing about metformin is that they do not cause, there's a very low risk of hypoglycemia when they are used alone. And the good thing about metformin also is that they do not cause weight gain. So now I move on to injections. For injections, we have insulins and your GLP-1 agonists. Now, insulins, they can be classified by their onset of action and by their duration of action. So there are many, many types of insulin. Okay, in general, we can broadly classify them into these four groups: the rapid-acting, short-acting, intermediate-acting, and the long-acting. And they differ by their onset, peak, duration. So when we talk about onset, we are looking at how quickly they start acting. And when we talk about peak, the peak effect of the drug, which is the greatest glucose lowering effect of the drug, how long does it take to achieve the peak effect? And when we look at the duration, we are looking at how long the drug will work in the body. All right, so when it stops lowering glucose level. So there are various types of insulin. The first type that I'm going to talk about is your rapid and short-acting insulin. Okay, so for rapid and short-acting insulin, we have insulin glucine, insulin lispro, insulin aspart, and regular insulin. All right, you will see that some of them comes in a pen form, all right, which is easier for administration. And then we also have those that comes in a vials form. Okay, some special things to note. Some things that you should note if you're on rapid-acting insulin. Rapid-acting insulin, as the name suggests, they work very quickly. They start to work from 1 to 20 minutes, all right, and the peak effect is about 1 hour later. So after you inject your rapid-acting insulin, it is very important that you consume your meals immediately and not wait for another hour or 2 hours before you take your meals. Because if you do that, there is a high risk of you becoming hypoglycemic. Your your blood sugar may drop too low. Then we also have short-acting insulin. In this case here, we have Actrapid, regular insulin. They take about half an hour to start working. So usually we will recommend patient who's on Actrapid to inject themselves about half an hour before eating. All right. The peak effect is about 2 to 4 hours. It can last for 1/3 of the day, 6 to 8 hours. We also have intermediate-acting insulin like Insulatard. For Insulatard, they last for about half a day, all right? We will usually tell patients to inject it about half an hour before their meal, all right? For the same reason, we don't want patients to be hypoglycemic if they don't consume their meal in time. And intermediate-acting insulin, they are usually combined with rapid and short-acting insulin. They are usually not used alone. Then we also have your long-acting insulin. Here we have insulin glargine, insulin detamere. They come in pen form. Now for these long-acting insulin, they don't really have a clear peak. They can last for up to 24 hours, which is why we usually only inject this once a day. And they are injected usually for most patients at bedtime. They are seldom used alone. Maybe you combine with short or rapid-acting insulin. Okay. So then we come to your premixed insulin. So as the name suggests, premixed, for premixed insulin, it is actually a combination of short-acting insulin together with intermediate-acting insulin. Okay. The reason why we give premix to patient is really to minimize the number of injections that the patient has to inject him or herself every day. So for premixed insulin, the important thing is that patient also needs to inject this before meal. I would say about 15 to 30 minutes as well. All right. So now I move on to GLP-1 agonists. In Singapore, we have liraglutide. We also have exenatide, but I would say that liraglutide is actually more common in Singapore. So how they work is that they actually help your pancreas to produce more insulin and reduce the liver production of glucose. Now, usually GLP-1 agonists, we do not use it alone. They are not considered first line. So likelihood of GLP-1 agonists being used is usually used in combination with metformin, sulfonylurea, or other forms of insulin injection. Okay, what we like about GLP-1 agonists is that there is a very low risk of hypoglycemia, and they provide dose-related weight loss. So this can be helpful in patients who are obese because the obesity may be causing the worsening of the diabetes. So we may give some GLP-1 agonists to help the patient to lose some weight. So that's for the medication for diabetes. Now we move on to hyperlipidemia, which is high blood cholesterol. All right. So I think Claudine has mentioned earlier on that when we receive our cholesterol level report, you see many different types of cholesterol. There's cholesterol, triglyceride, we have VLDL, LDL, HDL, IDL, etc., etc. All right. So importantly, in terms of medical management, what we can manage is to, what medications can do is to bring down your triglyceride, bring down your LDL, and there are also medications that can increase your HDL level. So there are various classes of drugs that we can use to bring down our triglyceride and LDL level, such as your HMG-CoA reductase inhibitors, fibrates, bile acid resins, niacins, and cholesterol absorption inhibitors. But in the interest of time, I'll only be covering the two that are circled in red. So the first one that we have here is your HMG-CoA reductase inhibitors. I'm sure you will have heard this before because it's so commonly used. All right. All drugs in this class actually end with the word statin. So in Singapore, you will see lovastatin, simvastatin, pravastatin, atorvastatin, rosuvastatin. There are many statins. All right. So how they work? They work by slowing down the production of LDL cholesterol in the liver. So surprisingly, our liver actually produces LDL. All right. Now, if you are on statin, it is recommended that you take it in the evening. So it's not uncommon to hear when you go to the pharmacy and they tell you, okay, take this at night. All right. For some statins, but of course there are some that you can take in the morning. But for those that you can take in the morning, there's no harm taking it at night as well. I mean, as long as it's just once a day. All right. Why do we recommend you to take it in the evening? Because LDL production is most active when you are sleeping. Okay. There are some concerns with the use of this drug. They may cause muscle breakdown or liver injury. So if you notice that if you're on statin and you notice that your urine is getting very brown, like the color of tea without milk, or you experience yellowing of the eye and so on, or you have unexplained muscle pain, please stop and see a doctor immediately. Now, I know that red yeast rice is a supplement that is commonly available over the counter. You can get it from retail pharmacy. But if you're on statin, I would highly recommend you not to take it together with red yeast rice without the instruction of your physician, simply because red yeast rice contains lovastatin, which itself, red yeast rice actually has some statins in it. So if you take both together, it may actually increase your risk of developing the side effects of statins. And then we move on to fibrates. We have gemfibrozil and fenofibrates. Now, fibrates, they work primarily to lower the triglyceride levels of your body. So how do they work? They work by reducing the liver's production. They also help to speed up the removal from the blood. All right. Now, some things to note. Fibrate may potentially interact with statin, but having said that, it is not uncommon. It is common to see patients who are on both statins and fibrate. It's not that you can't give both together, but if you're on both statins and fibrate, all the more you should pay attention to possible symptoms of muscle breakdown, which can come in the form of muscle weakness, unexplained muscle weakness, muscle pain, or like I mentioned, urine turning very brown. All right. Now I move on to medications that can be used for hypertension, which is high blood pressure. So as Claudine has mentioned earlier on, hypertension is actually defined as persistently high arterial blood pressure. Okay, there are many medications that we can use to treat high blood pressure, as you can see from my slide here. So in the interest of time, I'll only be covering beta blockers, angiotensin receptor blockers, diuretics, and angiotensin converting enzyme inhibitors. So let's talk about the first class of drug, diuretics. Okay, so as you can see from the picture here, it's a tab. All right, in Singapore, we have furosemide and hydrochlorothiazide. So why did I put a picture of a tab there? Because diuretics, they work by removing salt and water out of your body via urination. They are also sometimes known as the water pill. So after taking diuretic, you will feel that you will want to go to the toilet to pass urine more frequently. That is completely normal, and that means that the drug is actually working. All right. So diuretics, they can also be used in heart failure and kidney failure patients to get rid of excess water in their body. Now, some things to note: if you're on diuretic, you may want to avoid taking before bedtime, simply because we don't want you to keep waking up at night to go to the toilet to pass urine. All right. So usually diuretics are prescribed in the morning. If you need to take it in the evening, take it in the early evening. I would say maybe 5 p.m., 4 p.m. All right. Diuretics can sometimes also cause gout attack. Now, what this means is that if you have a history of gout and your doctor wants to start you on diuretic, it is very important that you inform your doctor that you have a history of gout before they start you on diuretic. They need to be aware, all right? And you need to follow the advice of your doctor on how to prevent yourself from getting a gout attack if you're on diuretic, okay? Sometimes diuretic can cause low potassium, which is a type of electrolyte, a type of salt in our body. So some patients may be supplemented with potassium tablets when they are on diuretic. And then I move on to beta blocker. So some of the common beta blockers that you can see in Singapore, we have atenolol, bisoprolol, carvedilol, labetalol, metoprolol. So they end with the word lol, L-O-L, okay? So how they work is that they slow down your heartbeat, and that will actually help to reduce your blood pressure. Beta blockers is also very commonly used in patients with heart failure or patients who have an heart attack, because that will help to prevent the overworking of the heart. All right. Now, some patients, when they are started on beta blockers, they complain that they feel more tired than usual. They're not able to exercise as much as usual. They may even experience cold hands and feet. Now, these side effects are usually only during the initial phase when you are started on this medication, and they should go away after a few weeks. But if you find that these symptoms are bothering you a lot, then you may want to discuss with your doctor about this matter. I'll move on to ACE inhibitors and ARBs. ACE inhibitors, the word ACE actually stands for angiotensin converting enzyme inhibitors. So in Singapore, there are many ACE inhibitors. We have captopril, enalapril, lisinopril, perindopril. These are just some of the prils that you can find. So they end with the word pril. Then for ARBs, which stands for angiotensin receptor blocker, we have losartan, candesartan, telmisartan, valsartan. So they end with the word sartan. So how these two classes of drug work is by relaxing the blood vessels. Okay, so that they are not so constricted. And they also help to decrease amount of water and salt in your body. And these two actions will help to bring about a drop in blood pressure. Okay, so it is also not uncommon for ACE inhibitors and ARBs to be prescribed in patients with kidney disease. Some things to note: ACE inhibitors can sometimes cause dry cough. So if you find that after you started on one of the prils, enalaprils, lisinoprils, etc., and you keep getting dry cough, meaning cough without phlegm, and it doesn't go away with cough syrup, all right, it could be a side effect of ACE inhibitors, and you may want to go and speak to your doctor about it. He may switch you to another class of medication or change you to another drug entirely. All right. So for patients who develop dry cough with ACE inhibitors, sometimes the doctors may change you to ARBs, which have a lower likelihood of you developing dry cough. For ACE inhibitors and ARBs, they are generally a very safe classes of drugs to use, but they may sometimes cause kidney injuries and high potassium level in your body. So what this means is that if you're on these two drugs, either of these two classes of drug, you need to go for blood tests once in a while. Okay, the frequency will depend on what your doctor recommends. All right, do not take this drug without going through any blood tests. All right. So now we move on to our question and answer time. So if you have any question, please feel free to post it in the Facebook comment, and Claudine and I will try our very best to address your inquiries.
Okay, so I see a question: margarine versus butter, which is okay for diabetic. Okay, so before that, I just need to read something. Whatever that we've presented earlier just now, the information in this presentation is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. So if let's say you have any queries, also always return back to the doctor, to your dietitian, pharmacist, to ask them more in details, because they have all your full medical records and they can actually advise you accordingly. So sorry, going back to the question again, margarine versus butter, which one is okay for diabetic? Basically, margarine and butter, they are both source of fats. So when it comes to a diabetic patient, our primary aim for them is actually to maintain a healthy body weight. So if let's say a person is a person is overweight or obese, definitely we would like them to reduce their total fat as a whole. So they can reduce margarine, they can reduce their butter intake. Okay, but if let's say you want to find out more about which one is a better form of spread for your bread, then of course margarine and butter, they are both butter itself, because it comes from animal source, they come from cow's milk, so they actually contains cholesterol inside. And whereas margarine, they are actually they have been processed, they are mainly from the plant sources. So actually margarine is also good for you to spread on your bread. But when you choose margarine, please look for the ones that states trans fat free, because what gives margarine a bad name is basically because in the past we have those hard margarines. What do we mean by hard margarine? That means you leave it in the open, they do not melt. Those are what we call the hard margarines. They are very high in trans fat and they have very bad effects in terms of a blood cholesterol level. So that's why butter is more natural in a sense, that because it comes from animal products. But as a whole, if let's say you want to choose margarine or butter, you can choose either one, but most importantly, don't overeat it. Okay, so the next question I saw is actually about, I see quite a couple of questions regarding diet, so I'll just answer them. So one question is about sea salt. whether is sea salt good? Because I always hear people say, oh, especially sea salt is more expensive. But comparing sea salt and the normal table salt, unfortunately, they have the same nutrients value. The amount of sodium present inside is the same. 40% of whether table salt or sea salt is actually made from sodium by weight. So whether I consume this sea salt or table salt, they have the same benefit. They have the same effects to the body. Okay, how do I measure the total salt intake in the day? Okay, so just now I mentioned that one day we cannot exceed more than 2,000 mg of more than 2,000 mg of sodium in a day. But in general, just don't go more than half a teaspoon of salt. Okay. The next question I see is in terms of consuming nuts. May I know if a person is suffering from uric acid problem? I suppose that your question is actually asking if, let's say you have uric acid, can you consume nuts or not when it comes to management of uric acid and how to portion? Okay, in terms of consuming of nuts and helping our blood cholesterol level, we always recommend about 2 servings of nuts per week. So what I mean by 2 servings is about 1 ounce, so 1 handful. Okay, about 2 servings a week, it's actually good enough. But when it comes to a person with uric acid problem, uric acid actually has another type of nutrition therapy to this. So in a nutshell, for uric acid management, it's very important for you to drink high amount of fluids to actually help you to wash out this uric acid. Okay, and of course, if let's say you realize that every time I consume nuts, I start to trigger my gout attack, high uric acid level, then we may want to find alternative to that. Okay, next, should we avoid carbohydrates from our diet if we have diabetes? The answer is no, because like I mentioned earlier just now, carbohydrates is very high. We need carbohydrates in our diet because they are the primary source of energy for the body. So even if a person has diabetes, we still need to consume carbohydrates because we need that as a form of energy. If I do not consume carbohydrates at all, and yet I'm still consuming some of the medications that just now Candice mentioned earlier, this can further cause hypoglycemia. It will cause your blood glucose level to drop below the healthy level. And this person may experience from a whole lot of different conditions like dizziness, cold sweat, they may tremble, but in worst case, they may end up in coma. So if you have diabetes, you still need to have carbohydrates in your diet, but you just have to take note of the portion size that you are eating, make sure they are consistent over the day, and also eat at regular meal timings. Okay. I see another question is about canned tuna. Is it okay to buy canned tuna in mineral water? Yes, that's fine. You can go ahead and purchase that. That's good. As long as it does not contain brine, because brine is mainly salt water. If your tuna is soaked in the salt water, it actually increases the sodium content. Okay, I see another question. Is it healthier to replace sugar with agave or honey? So if you replace with honey, honey actually has the same effects as sugar. It still gives you the same amount of calories and can actually increase the calorie intake, calorie content. Okay, so I see another question which is about coconut oil. Some say it's healthy and good for the heart. Why do I say that it is bad? Okay, there are a lot of, you may have heard a lot of research. They say, oh, coconut oil is good for the heart. But I have to emphasize that the evidence to say that coconut is good for heart is still not conclusive. So if let's say you go to some of the American Heart Association website or Singapore Heart Foundation website, you will still find that you will still encourage a person to avoid food that's high in saturated fats, which in this case, coconut fats contains high amount of saturated fats. Okay. Yes, I see another question. What about a person just found out he or she has a pre-diabetic? Okay, so I see that, okay, this person just found that he or she is pre-diabetic and not treated. Can diet plan revert the situation? So the good news is, yes, it can help. So when a person is pre-diabetic, if let's say this person exercise regularly, they control their diet well with my healthy plate, which I've talked about earlier just now. If let's say the person is overweight and he or she lose weight, it can actually help to reverse the condition. Okay, so I see another question. Any natural remedies to reduce or cure joint or muscle inflammation? Does taking turmeric pills work? So Candice, do you have any answers to the question?
Well, I haven't really heard of any natural remedies to help reduce or cure joint and muscle inflammation. Even if there is, usually the evidence is not very conclusive.
Yes.
So if you really do experience inflammation and so on, you may actually need a stronger medications. You may need to see a doctor. They may need to prescribe you with some painkillers, anti-inflammation, or even steroids as well.
Yeah, so just to add on, like turmeric, a lot of people they may have read about turmeric, and there's a whole long list of good effects that is claimed, but I just have to emphasize that there isn't a lot of strong evidence to support all these said benefits. Okay, so there's some questions about medications. Maybe Candice, would you like to take note of them?
Okay, so it's true that too many medications may harm the liver. I would say possibly, also not really well. It really depends. Okay, because like I mentioned, our medications are cleared from the body primarily through the kidneys or through the liver. So some medications may be cleared through the kidneys, so that may actually help to spare your liver. Some medications may be cleared through your liver, so it may also mean that your liver will have to work harder. But nonetheless, what we are more concerned about is actually medication that actually may cause liver injuries, that have a higher tendency of causing liver injuries. Now, the good thing about the liver is that the liver is actually regenerative. So if we do notice that there are medication that causes you to have, when you start developing symptoms of liver injuries to medication, such as when you have yellowing of the eyes and so on, then you can stop and see a doctor immediately. Usually the liver after a while should heal by itself. All right, but weighing the risk and the benefit, if you need that amount of medication, then you should continue taking your medication, and you should not stop your medication without the advice of your doctor. Then we move on to the next question. If we miss a dose of medication, what should we do? In all situations, if you miss a dose of medication, you should not double dose. Meaning that, okay, if I miss it and I only remember tomorrow, I take 2. You should never ever do that. For some medication, you may be able to take, if you miss it within 8 hours, usually you should be able to take it and resume at the same time the next day. But for some medication, you may not be advised to do so. So because there are so many different types of medication, it is really quite hard for me to tell you based on this session whether you should take it or not. So the best way to do it is really to clarify with the dispenser, whoever that's providing you the medication, to check with them what should you do if you miss a dose of medication. But the moral of the story is, the take-home message is, do not double dose.
Okay, I see another question about taking too many supplements pale will cause liver failure. Okay. Perhaps I will just share supplements pale because they all come from they are synthetic. Most of them are synthetic. And of course, supplements, we have the vitamins, we have the minerals, and some vitamins are water soluble, some are fat soluble. So which means, right, some vitamins, they need to dissolve in water in order to be absorbed, whereas for some, they need to dissolve in fats to be absorbed. So in this case, if let's say a person is eating well and he or she is still consuming supplementation, I wouldn't say that it causes liver failure, but rather it may actually cause toxicity. In other words, because whatever vitamins, minerals that our body needs is important for us, but if let's say we exceed the amount that our body needs, it will lead to a toxicity effects. So for instance, there are some supplements that are fat soluble. What happens is that they have a higher tendency to store in our fats, so it will stay in the body for a longer period of time, and therefore it could lead to toxicity. Okay, and this will have a range of different problems that will appear in the body. Okay, so I see a question asking about peanut butter jam. When you are referring to peanut butter jam, do you mean peanut butter with jam in the mixed in jam, or just peanut butter to spread on your bread? But regardless, if let's say you buy a peanut butter but with some jam inside, of course, this jam actually is very high in sugar, and this can actually further increase the calorie of the particular food product. So let's say if a person wants to achieve a healthy body weight, this may not be a good choice of jam. But if let's say you would like to consume peanut butter, just a normal pure peanut butter to spread on your bread, that's actually fine. Okay, peanut butter is actually, of course, we all know it comes from peanuts. They are very high in, they have very high in polyunsaturated fats, so they are actually good for the body. But having said they are good types of fats doesn't mean that we can overindulge in it. Fats is still fats. They will still give us excess calories, and consistent high amount of calories intake can still make us put on weight. So in short, peanut butter is fine, but you still have to consume in moderation. Okay, so I see other questions about medications, about amlodipine, then some other medications. Maybe I'll leave it to Candice to talk to you more about it.
So here we have a question for amlodipine. Under what category is amlodipine, and if there is any side effects associated with amlodipine? Now, amlodipine is actually not covered in my talk. It's actually under the category of calcium channel blocker. So there are some side effects associated with amlodipine, such as low blood pressure, flushing, all right, and swelling of the legs. But nonetheless, if this happens, you should always consult the doctor. Okay. Now the next question is, can you please confirm the side effects of Trilop, a fibrate? So side effects of fibrates, there are many there are some side effects, but the main concern is really about the muscle breakdown and some possibility of liver injury. So these two are the most concerning side effects of fibrates. So like I mentioned, if you do experience any signs and symptoms of muscle breakdowns, which includes unexplained muscle weakness, unexplained muscle pain, darkening of your urine, or if you experience any sign of liver injury such as yellowing of your skin, yellowing of your eyes, which is a sign of jaundice, please stop and see a doctor immediately. Okay, so can I take supplements with my medication? Now, this is a question that we always get from patients. Personally, if the supplement is not prescribed, we would usually not recommend patients to take supplements with medication, because there may be medications which interacts with supplements, and this may actually cause an increased risk of side effects of the medication. So if you're on medication and you want to take a supplement, what should you do? Always check with the pharmacist. In retail counter, there are pharmacists around. Just check with them whether there is any interaction, or check with your doctor before you consume the supplements. Okay. So fibrate, any side effect? I think we have talked about that already. So we move on to the next question about eggs.
Okay, sure. So I think a lot of people who has high cholesterol, they often ask this question: how many eggs can I eat daily? Okay, egg, particularly egg yolk, is very high in cholesterol. We need about 300 mg of cholesterol per day from our diet. So of which egg contains about 130 mg. So if let's say I eat 2 eggs per day with the yolk, I would suggest that you probably want to remove the egg yolk and eat the egg white. And of course, if let's say you enjoy eggs, and if you can remove the egg yolk, you can eat as many egg whites as possible in a week, in a day. Okay, I hope I answered this question. And next question I see is that the sweetness of table sugar, which is processed product, and the sweetness of fruit in its original form, such as mango, rambutan, or maybe papaya, are they the same in its properties? So like DNA, are they the same? Okay, table sugar and the sweetness from fruits. Okay, so fruits itself, they are mainly contributed by fructose. And of course, when we talk about sugar intake, we wouldn't want a person to exceed their total sugar intake in a day. However, you may realize, if that's the case, why do we still recommend a person to consume fruits? Okay, because fruits, apart from the fructose it contains, apart from the sweetness it contributes, don't forget that it also contains things like antioxidants. That's why you have the colors of the fruits. It also contains vitamins and minerals as well. So if let's say you want to have some sweet tooth in the middle of the day, you want something sweet, instead of consuming things that's high in sugar, you can actually have a piece of fruit instead. Okay, and why do I say that? Because fruits contains all the nutrients and they are more beneficial for your body. But one important thing to take note of is that do not overeat your fruits as well, because they still have calories, they still have the sweetness inside there. Too much of it, they will still lead to high blood glucose level. And of course, too much of it can still lead to high calorie intake and also cause the person to put on weight. Okay. So I see some other questions I just covered some questions about diet first. I heard that diabetics are advised not to take fruits. Is it true? The answer is false. Okay, diabetics are still advised to take fruits because of all the nutrients it contains, which I've mentioned previously in the question above. So they can still consume, but it's important for them to take note of what they eat along with their fruits. For example, if let's say the threshold, it depends on individual, okay, because when it comes to dietary advice, we have a lot of aspects to look into. But typically, if a person has a bowl of rice, about one bowl, and they have a piece of fruit to go along with, we are totally fine with it. But some people, when they eat fruits, they went overboard. They say, oh, fruits is good, so they went to eat 2 apples, 2 oranges at one time. That's too much. So very important, again, is the quantity that you consume and the timing you consume as well. So for this, if let's say you are keen to take fruits, but you're really not sure when to take, what time to take, what to go along with it, it's always best to actually find a dietitian to assess your entire diet, and they can actually give you appropriate advice for that. Okay. So maybe Candice can...
Maybe I'll address the question on whether can we use natural remedy for high cholesterol, high blood pressure, high blood sugar. I haven't mentioned it. Yeah. So basically the 3 conditions. Natural remedy, well, if you are concerned about these 3 conditions, there are supplements available. For high cholesterol, there is red yeast rice, which you can purchase from retail pharmacy without the prescription of your doctor. Now, for high cholesterol, yes. Okay. Then for diabetes, there isn't really any supplements that you can take, not that we have heard of. And for high blood pressure, usually there really isn't any supplements as well. So really, when it comes to natural remedy, there is pretty much only applies to high cholesterol. So besides red yeast rice, there is also fish oil supplements that you can take. Fish oil is able to lower the LDL level by a little, but fish oil is more effective in increasing the level of your good cholesterol, which is your HDL. Okay. So what does it mean for, so another question here that we have here is, what does it mean for someone who is told that he or she has a fatty liver? Can the condition be reversed? I think fatty liver can be due to many reasons. Can be due to diet, can be due to alcohol intake. Whether the condition can be reversed or not, it really depends on the lifestyle changes of the patient. So we will strongly advise you to seek the consult of your doctor.
Yes.
Okay.
And also for fatty liver itself, because fatty liver, to manage a person with fatty liver, of course, there are many different causes to it. But if let's say you would like to know more about dietary intake, how it actually helps, because a person with fatty liver is usually associated with weight issues as well. So by reducing your weight, reducing your total fat intake, reducing your sugar intake, it can actually improve the condition of fatty liver. Okay. Then we have one question. If I drink 500 ml of water in one go, is it good for the body, and does it contribute to my increased belly? So if I'm able to clarify, increased belly, you mean increased in terms of the waistline temporarily? Okay, so actually it's fine for you to drink 500 ml of water at one go, because when we drink, our stomach actually do expand quite a little bit. So if let's say you drink this amount at one time, our stomach itself actually expands. So you may find that your belly may increase in terms of the waistline temporarily. So that's actually considered quite normal. Okay. Then we have one question about what advice would you give to someone who gets occasional reflux and also vertigo? So maybe I'll just cover the part about occasional reflux. So a few things we need to note is that what causes the reflux? Is it because of stress? Is it because of some other medical conditions? But generally, when a person has reflux, we would actually advise them not to lie down right after their meals. Try to sit upright for at least a good 2 hours so that your food can actually goes down your gut, so it can actually prevent your stomach acid from going upwards. And of course, small frequent meals plays a very important role, because in the case of a reflux, there's too much of stomach acid, and when you eat too much of food at one time, these stomach acids actually tend to exit your stomach. So that's why it causes the reflux. So a small frequent meals is helpful to manage a person with reflux. Then of course, but most importantly, we need to find out what is the main cause of the reflux in order to give you a proper advice for that.
Yeah. So like Claudine mentioned, there are medications that you can take for reflux that you can purchase over the counter. We have like omeprazole, ranitidine, famotidine, etc., and antacid. But it is important that you actually seek help from professionals like the pharmacists or the doctors, so that we can better understand your condition before you self-medicate. Now for vertigo, we really need to know what is the cause of the vertigo. So you actually need the doctor to properly diagnose you, because vertigo can be caused by several conditions. And depending on what is the root cause of the condition, the type of medication that we use is also very different. All right. Now I move on to the next question. So someone here says that the BP reading with the Omron BP monitor is always within 140 and 90. But in a clinic and elsewhere, the BP will always go higher, the blood pressure will go higher. Now the doctor has discontinued my atenolol and decide to self-monitor with annual blood test and review. Is this really white coat syndrome? Possibly, can be also, but I do agree that sometimes when we go see a doctor, our blood pressure will increase. So as we mentioned in the talk, when you have high blood pressure, hypertension, it is diagnosed as persistent high blood pressure. So in your case here, it doesn't seem like it's persistent, and the doctor has enough reason to discontinue with your atenolol. So it really could be a white coat syndrome, but the more important thing is that you continue to monitor your blood pressure at home and also to go for your health screening regularly. Okay.
Okay, so I saw a question about high cholesterol. Is high bad cholesterol produced by the liver? What's the cause? Okay, basically, regardless whether it's a good cholesterol, which is a HDL, or the bad cholesterol, LDL, they are all produced by the liver. Okay, this is just one of the functions that our liver has. So it's meant to produce cholesterol. But whether it produces a good or the bad cholesterol, it's heavily dependent on what type of fats you consume. If a person's diet is very high in saturated fats, very high in animal fats, high intake of pastries, deep fried products, cakes, then naturally our liver will produce more bad cholesterol. But if a diet is very high in monounsaturated fats, such as like avocado, or they have polyunsaturated fats like oily fish, or they have canola oil, when they cook, then the body tends to produce more of the good cholesterol, the HDL. So basically, liver on its own produces cholesterol, because cholesterol is still needed in our body to actually produce cells, to help to make our cells, to help to make hormones, to actually help to process, digest, or transport the fats. So we still need cholesterol in the body, just that when it goes beyond the healthy level, it becomes detrimental to health. Okay. So there's one question asking about how do I know if I need more calcium or vitamin D? My GP said no need unnecessary blood tests. Okay, I wouldn't advise, you don't have to go for more calcium, but as of the age of 64, it's just important to have adequate amount of calcium, which is about 1000 mg per day. So if let's say I would like to convert 1000 mg of calcium into my daily intake, for example, if you go for a glass of high calcium milk, Okay, high calcium milk, just 2 glasses a day is enough to meet your requirements. So you don't have, so I wouldn't say you need more, but you just have to consume adequate amounts of it. Okay, or even if let's say you want to go, if let's say you don't drink milk, but you don't mind taking soy milk, you go for those high calcium soy milk or those soy milk which has added calcium into it. Those fortified calcium soy milk, just about 2 glasses a day, it's enough to meet your requirements. And to ensure that you have sufficient vitamin D, just go under the sun for just 10 minutes a day. You can expose your palm, your feet, your hands, or your face. Just 10 minutes is good enough for you to achieve the amount of vitamin D that you need. And also, if let's say you consume oily fish, okay, you don't have to worry about vitamin D deficiency because those are actually good sources of vitamin D as well. Okay. So maybe, Candice, would you like to answer the question about glucosamine?
Yeah. So we have a question here about whether excessive glucosamine or if in the case from supplements is harmful in our body. Yes, too much of anything is always bad for our body. So please do not eat more glucosamine that is recommended by, that is more than the recommendation. All right. Now I have a question here about someone who is allergic to statin and is on cholestyramine. So what is the side effects of this drug? Now cholestyramine do have the usual side effects such as nausea, vomiting, and so on. But what we are very concerned about, I mean, which is also rare, is the blocking of your bile ducts. All right, but this is really quite unusual. So if you notice that you're feeling a bit unusual, then before, please stop and see a doctor immediately. All right.
Okay, so I see one question asking whether can I replace white sugar with brown sugar? This is what this is actually a misconception that many people have, just because brown sugar is less processed compared to white sugar. But in fact, brown sugar shares the same nutrients value as white sugar. So if let's say I want to control my blood glucose level, I want to ensure that I achieve a healthy body weight, best is actually to avoid both sugar because these still contains calories. They will still give you, they will still make you put on weight if let's say you have excessive calorie intake. So are there any other sweetener instead? You can actually look for some other sweeteners like artificial sweeteners, aspartame, you can still like stevia, monk fruit, all these are still fine as well. Okay. Can you recommend superfood instead of Western medication to prevent these common problems? Okay, there's actually a hype about superfood, things like chia seeds or quinoa, etc., etc. But in order to prevent common medical, now we are talking about prevention. To be honest, you do not need superfood to actually help you to prevent all these chronic conditions. It's just a normal, healthy, balanced diet, like my healthy plate, which I've mentioned earlier. These are actually good enough to prevent all these medical conditions. Okay. Fruits better before or after meals. Okay. Fruits before or after, actually, it doesn't really matter. Just that some people say it was better because after you eat a fruit, you feel fuller, so the tendency of overeating is actually minimized. But how our body processes all these fruits, whether before or after meal, is actually the same. Where whatever food we consume, our body wouldn't be able to identify as, oh, this is chicken, this is egg, this is fruits, this is abalone. No, our body don't recognize this way. Our body just recognizes as, okay, now this person consumes foods, so I can actually sense, oh, there's vitamins, there's minerals, this is carbohydrate, this is protein, and that's how our body sense. The body actually senses the nutrients rather than the food item itself. Okay, let me take a look whether I missed any other questions.
So maybe I take one question
yeah, sure.
first while Claudine is looking through. What will happen if there are fatty acids in the liver? I believe you are mentioning that you have fatty liver and how to get rid of them. There may be instances where you may require medications, but most importantly, at this point here, you need to watch out for your diet. All right, reduction in fatty food.
That's right.
What Claudine has mentioned, and also alcohol.
Yes, and sugar intake as well. Okay. So I have one question about if taking some supplements or natural remedy can help to reduce high cholesterol, high blood pressure, high sugar, can I stop medicine doctor prescribed? I guess both of us have the same consensus. The answer is no. Okay, the medications are prescribed to you for a reason. Okay, so you still need your medications to control all these different medical conditions. And supplements or natural remedy, to be honest, there are very, very, very limited evidence to show its benefits. So it's still advisable for you to consume the medications that the doctor prescribed to you. Okay. Okay. So what is IBS? IBS is irritable bowel syndrome. So this usually occurs when a person, when they're anxious or when they're nervous, that's when their gut starts to malfunction. Yeah. That's when they will actually run to the toilet, or they have constipation, or some of them will pass out a lot of gases. So it's actually a condition that is heavily related to the psychological effects. Okay, and of course there are some people, they could also be allergic to certain food, but this is actually another topic of its own. This will take me another 1 hour to cover dietary and IBS. So maybe this time around I may have to skip to the next question. I'm so sorry about that. Okay, so one question is, what would be the benefits of taking probiotics? Okay, probiotics are actually live, good bacteria for the body. So when we actually consume them, all these good bacteria actually colonize. So that means they actually live in our large intestine. So when they live in our large intestine and they thrive, this can actually prevent all the nasty bacteria from invading our gut. So when we consume food that's with probiotics, it actually helps a lot in terms of our gut health. Okay.
So we have a question on whether osteopenia is reversible. Osteopenia is actually the loss of your bone mineral density, usually one stage before you develop osteoporosis. I think at this point where you have osteopenia, the main goal is to prevent you from progressing to osteoporosis, which increases your risk of fracture. Because as we know, past a certain age, our bone no longer get stronger. They either stay where they are or they just become more brittle. So at this point here, if you have osteopenia, we are looking at preventing you from developing osteoporosis. So what are the ways that you can prevent yourself from developing osteoporosis? Like Claudine mentioned, consume calcium.
Yes, consume adequate amount of calcium, because what happens to our body is that when we are not consuming enough calcium, our body will look for alternate source of calcium within the body itself, which is the bones. So the calcium from the bones will leave the bones, will break down and enters into our blood, because our body needs blood calcium to function as well. So in this case, this can actually worsen off osteopenia. So in order to prevent osteopenia from progressing to osteoporosis, the main key thing is consume adequate amount of calcium to start off with.
And I think besides calcium, I think one thing that we frequently forget about is vitamin D.
Yes.
So the best source of vitamin D in Singapore, sunlight.
That's right, because vitamin D actually helps our body to absorb the calcium that we consume. Okay, so I see one question about, I've been avoiding all food which cause high LDL, but my LDL level is still high. Any reasons?
Genetics.
Yeah, it could be genetics. Okay, it could be genetics. If let's say you look into your family history and you realize that your family members, your siblings, all of them has high cholesterol, high LDL level, there's a possibility that could be one of the reasons that cause you to have high LDL level. And also, if let's say you are still unsure whether you are eating the right thing, again, I'll advise you to visit a dietitian, because we actually do a very, very detailed analysis of your current diet to see what other food that you consume that could actually increase your LDL level. Okay. There's one question. Daily, I use 1 tea bag and top up throughout the day till night in place of plain water. I think by the time you do the second, you add in the second, you add the third glasses of plain water to your tea bag, probably it's a bit bland already. But generally, I don't see it as a main problem, because it's still a kind of fluid source to your body. But you just have to take note what kind of tea you use, because some tea actually do have a diuretic effects as well that makes you thirsty. Okay, so I'll advise you can have a tea bag, top up about 1 or 2 times, I think it's best that you may want to move on to drinking normal plain water instead.
Yeah, plain water is still the best.
Yes, that's right.
So we have a question here. Once we start cholesterol medicine, is it for life? Okay, the good news is it's not for life. All right, so what happens is that if you are started on cholesterol medicine, the doctor would call you in for regular blood tests, maybe every 6 months or maybe once a year. And if they find that your cholesterol level is good enough, he or she may actually cut down the dose or may even take you off the cholesterol medicine entirely. But this will this also heavily depends on your lifestyle, your diet. Yeah. So right. It is possible to stop cholesterol medicine if your cholesterol level is good. Okay. So is lecithin effective to control triglyceride? Again, we do not have enough data to support the use of lecithin to reduce the level of triglyceride. So if it's used, it's probably just as a supplement level. If you do have high triglyceride, you may actually require some medication.
Yes, and also diet plays an important role as well, because like I mentioned earlier just now, where your triglyceride comes from. So triglycerides are mainly from fats itself. So, and if there's excessive sugar intake, it could also increase your blood triglycerides level. So you may want to relook into your diet and see whether you're consuming high fat intake. Are you consuming high sugar intake? And one last thing, alcohol. Are you consuming excessive alcohol intake? Because all this plays a role to your blood triglycerides level. Okay, and like what Candice said, I would like to reiterate, there's no conclusive evidence to say that lecithin helps to reduce your blood triglycerides level. Okay.
So we have a question here. Is thyroid medication for life? It's really hard for me to tell you because thyroid medication, are we talking about high thyroid level, low thyroid level? And it really depends on what is the underlying condition that is causing you to have this variable thyroid level in the body, higher or lower. So in some patients, yes, it's for life. In some patients, it's only for a certain period of time. Okay. So if you find our talk useful, do like and share the video with your family and friends to help them pick up these useful tips at their own pace and convenience.
And to learn more about age gracefully with proper diet and medications and other NSA courses by Nanyang Polytechnic, you can actually contact Candice. Okay, Candice at this particular email address, or you can visit the website below to actually find out more about the courses that we offer from, yes.
All right.
Okay.
So please call our number as stated in the slide there or visit the NSA website to explore the many learning opportunities for seniors age 50 and above. Like and follow our Facebook page to be notified of new content in the future.